Good evening, everybody. I'm going to call the meeting of the Board of Health to order. And first of all, I'm going to ask the Board of Health members to identify themselves, introduce themselves. Leo, would you like to start?
Sure. Hi, Leo Negron Cruz, I'm member of the board.
Michael Parado, member of the board.
Thank you. Francis Anthes, I'm actually the board chair.
Gary Rosen, member of the Board of Health.
Okay, and then I would just ask the other people who are participating to identify themselves as well. Tamara?
Tamara Lindy, the Director of the Division of Public Health.
Sherry Tangri, Grant Manager, PHE Capacity Building.
Thank you. And now I'd ask for the folks who are on the video.
Hi, I'm Dr. Michael Hirsch, Medical Director for the Division of Public Health.
Hi, Amelia Houghton here, Chief of Public Health Nursing.
Mickey Nixon, Deputy Director, Division of Public Health.
Anyone else?
Brenda Wright, Principal Clerk, Division of Public Health.
Anyone else like to identify themselves? Okay.
Desiree Sutton, Business Manager.
Thank you, Desiree. Sorry.
No problem.
Maddie Castillo, Commissioner of Health and Human Services.
Thank you, Maddie. Anybody else? Okay, then I'm going to move us right along to the minutes of the last meeting. And hopefully you've all had a chance to take a look at them. There's a couple of things that I thought might need clarification. One was State Representative Mary Keefe and the people who are there. I think if we put in State Representative, it makes more sense. Otherwise, the 15th Worcester is just kind of hanging out there. So I would put her title in as an amendment, if anybody would go along with that. And then I think it's like page 6. Maybe it's 2, 4, 6. Maybe it's page 7. The Jahira is the person who's the presentation is talked about, but it's Police Officer Pat Harrington, and I think we should probably correct that. He's not a congressperson at this point in time. And I think we want to give him his right title. So sorry, maybe I was a little hung up on titles this time, but it seemed like those were worth correcting. So I'm looking for a motion that would include those 2 corrections to accept the minutes.
I so move.
Thank you. Is there a second?
Second.
So Leo and Michael, thank you very much. We're going to now vote on the minutes of the last meeting for approval. Gary?
Gary Rosen, yes.
I'm sorry. Michael Parado, yes.
Leo?
Leo Negron Cruz, yes.
And Francis Anthes, yes.
And Madam Chair,
Yes,
is it Brenda who does these minutes?
Sometimes it is a group effort because Brenda was on vacation, so I think that she did not do these totally on her own. Is that correct, Brenda?
I'm sorry, could you repeat?
Yes. Did you do these minutes, or because you were on vacation, was it a team effort?
I did it.
Okay.
Because
you weren't even here when you did it.
you did a terrific job, Brenda. I mean, these are comprehensive. So good work.
Thank you.
Wow.
Thank you.
Excellent.
Thank you, Gary, making note of that. It was a good thing to do. I'm going to move then to the next item of our agenda, which I think is Amelia talking to us about the communicable diseases update. And it's in our packet, so we don't have to read every line, but there are, I think, some trends that we want to make note of. Amelia?
Yes, so hi everyone, Amelia Houghton here, to the chair, to the board. So notable observations The COVID-19 cases have tripled from the previous month, which obviously that means there's increased transmission. The influenza and the salmonella have both declined a little bit. We still have a couple here and there. The interesting case was a travel-related malaria case. So something like that makes me want to highlight the importance of travel history in case investigations. And for malaria, the risk varies by country and region and traveler behavior. You can get all these detailed information, country-specific malaria risk and prevention guidance in what the CDC calls the CDC Yellow Book. Okay, and malaria is transmitted from an infected mosquito.
And Amelia, do you have the sense that that's one of the things that the CDC is committed to, so we're still getting good information from the CDC on that?
Yeah, at this point in time isn't changing, especially with the arboviruses. There isn't too much that can change. They have to keep up with updating the specific regions where there's higher transmission versus lower. But as far as I know, that's still a go-to guidance, the Yellow Book. I don't know, Dr. Hirsch, if you know anything about that.
That's great.
It's always been the go-to.
That's great.
Through the chair, I think all bets are off on CDC, but we can look at last year's version. That's all I can promise.
Okay, thank you. I mean, that's really what the question is in terms of the CDC right now. So thank you. Anything else, Amelia, that we should be paying attention to?
No, I've included a little bit of information from the weekly arborvirus update, and the information here is from last week, not from today. And there were over 7,600 specimens tested between June 15 and August 30th in Central Mass, Worcester County area. And there's a complete aerial and ground spray map available. Literally, it's called 2025 Spray Schedules, Central Mass Mosquito Control Project. There were samples identified for West Nile virus, so personal protective measures are recommended. And I've listed here the prevention methods that we usually list every week. Repair window screens, wear mosquito repellent between dusk and dawn, wear long sleeves and long pants from dusk to dawn, use mosquito netting on baby carriages and playpens, protect your pets, and especially if an animal is suspected of having West Nile virus or Triple E, owners are required to report that incident to the Department of Agricultural Resources, Division of Animal Health, and there's a phone number on the report that was added to the communicable disease report, which will be in the meeting minutes next time. That's really it. It's just prevention and protection, arboviral diseases, being careful when you travel, make sure you're updated on your vaccines for travel, and just being aware of COVID and the increased transmission and staying up to date with your health.
Thank you. Thanks, Amelia. We appreciate that report. Dr. Hirsch? I think
Yes,
you're
thank you,
next on our agenda.
Madam Chairman. Yes, can everybody hear me? So just on that note of arboviruses and tick-borne viruses, I had a very positive discussion with Dr. Jonathan Runstadler today. He is the head of infectious disease at the Tufts Cummings Veterinary, and we had a very good exchange during the peak concerns about the bird flu, and we keep that. The reason I contacted him was I don't know how many of you caught this in the news, but there was a lot of concern about the screwworm. This is it's a larva of a type of fly that has made several attempts over the years to make its way up from South America to the United States in a very innovative program. Back in the 60s, the Department of Agriculture developed a huge cohort of sterile male flies to mate with these fly that becomes a screwworm, and that stemmed the tide of the invasion. And we haven't had another invasion until there was just now a case reported in Texas. So there was some of our local folk were following this on the news, and they communicated at the EPA health line that they were worried about eating red meat. So the life cycle of this parasite is that this fly lays its eggs in the meat of beef cows usually, and those eggs become the screwworm. And if you eat meat with the screwworm in it, particularly if it's undercooked or raw, you can get the screwworm in you. And if you as a human have this screwworm inside of you, it literally can bore its way through intestine. It can cause terrible allergic reactions to meat in general. It's not a fun disease entity to have. But Dr. Runstadler was not concerned about it making its way up north. And I think we can have the citizens of Worcester County feel comfortable that not only is it unlikely that it will make its way up north, but the Department of Agriculture is really looking out for this. And where it might come into play is if for some reason you're traveling in Mexico or you're eating meat that's been imported from Mexico, it's probably a good idea to avoid that kind of consumption, or to make sure when you cook your meat that you do it very well done so that the screwworms don't survive the cooking process. So that's just another example, I think, of how climate change is kind of affecting all of these kind of arboviruses and tick-borne diseases and now this kind of fly, because they are moving up to us because our weather patterns are getting warmer. So as far as the more conventional kind of threats that we have, flu and COVID, as Amelia said, on July 1st, there were 300 weekly cases of COVID in Massachusetts, and this past week there were 1,500 cases. So it's really increased over the course of the summer, and this particular iteration of COVID has been euphemistically called the razor blade throat COVID. It causes lots of the same symptoms that flu does and like past iterations of COVID does, but in particular, people complain about a very sore, irritated throat that is very, very annoying. So the recommendations are still the same. If you feel that you've been exposed or you feel like you have a flu-like illness, it's a wise thing to get an antigen test. If you test positive, the recommendation is, take the time to not go into work, not expose others to this by wearing a mask, and then you can generally in 3 to 5 days return to your normal occupation unless you're very, very sick. But you might consider wearing a mask out till 7 days if you go back to work, just to protect your coworkers. Now, if you have those risk factors that we've talked about, if you're over 65, if you got diabetes, heart disease, pulmonary disease, immune deficiency, or problems with obesity, rather than allow the COVID infection to get severe, you might talk to your primary care doctor to get a prescription for Paxlovid, which can make the length and severity of the course of COVID much less. We haven't gotten any recommendations from the state about avoiding mass events like, football games or indoor basketball games or anything like that. We haven't gotten any recommendations about social distancing or masking, but I fear that we are going to see further increases. These numbers that we're quoting, that Amelia and I are quoting, are probably under reports because many people are probably walking around with COVID without even realizing it. They might have a stuffy nose or sore throat and think that it's nothing. I have a son-in-law that's working in the emergency department at UMass, and he said it's been quite striking that in the process of working up patients that came in for other maladies, when they report that they have some respiratory symptoms, they test them and incidentally find that they are positive for COVID. So I think it's much more prevalent in the population than we know. So unfortunately, the recommendations coming out of the CDC are that only people over 65 or people younger than 65 with some of those comorbidities that I mentioned should get COVID, like the normal, healthy 40-year-old, 50-year-old, or child is not being recommended to get it, nor are pregnant women recommended to get it. And this is being challenged by the American Academy of Pediatrics, the American Academy of Obstetricians, the American Medical Association have all filed counter recommendations to try to make sure that if you want the vaccination, you should be able to get it and also get insurance companies to pay for it. This has really had a chilling effect all through the country. There are 16 states where CVS is not offering COVID vaccinations. And I got mine today at a CVS here in Massachusetts, thank God. And I think that we need to push back on the recommendations that are coming out of Atlanta. And on that note, the hearings last week with our HHS Secretary, Bobby Kennedy Jr., are widely being panned by almost every medical organization, medical school, and nursing organization, pharmaceutical organizations that are out there. The instructions and the answers to his questions were so contrary to what he testified to during his confirmation hearings. He's been contradictory in every turn. And all we know is that he has, as we talked about last month, the panel that he now has empowered to decide about vaccine recommendations has 6 out of 8 that are pretty confirmed anti-vaccination people. So I don't know whether the Senate Oversight Committee will have the courage to try to demand his resignation or impeach him. But in many ways, I think he's already lost so much credibility. The shameful part about that is it just leaves the country, the average citizen, confused. What should I do? What should I do? So we're taking our lead from Robbie Goldstein, who's the head of the Mass Department of Public Health. He has been a stalwart defender of the vaccine recommendations in our Massachusetts public school systems. And I think that, so far, Governor Healy has been very supportive of continued coverage in the mass health organizations for the vaccines, so that it should not be as difficult in our state to get them as in others. But I have, a set of children that are having their kids enter preschool, and they were trying to ascertain from the school director what percentage of your students are vaccinated, and we have not been able to get an answer. And I think this is really going to be a challenge for all age groups to feel comfortable that they are not going to have their kids come home with a preventable disease that could end up becoming something awful, like a measles that goes into encephalitis, or a case of diphtheria that never should have reared its ugly head again. It was basically beaten down 30 years ago when the triple vaccination of DPT was invented. Pertussis also has been making comebacks in the southern states where vaccination rates are low. So these are going to be very tough times for public health. I think we already had suffered a lot of credibility issues after the pandemic, and now it seems like the confusion that is being sown out of Atlanta and the recent firing of their experts has just made everybody much more polarized about this than they should be. So I'm very grateful that here in Worcester and here in Massachusetts, we're letting the science direct us and not let strange theories about vaccines causing autism waylay the tremendous good that vaccinations have done since the days of Edward Jenner in 1796.
Thank you very much, Dr. Hirsch, for a very comprehensive report on where we're at. Because it's so confusing, I just want to kind of reiterate. I am assuming, based on what I've seen with you here tonight, based on what I've seen from Governor Healy, that if you're in Massachusetts, you should be able to get a vaccination for COVID if you want one, probably through your local pharmacy, possibly through your doctor. Is that accurate?
That's accurate.
And I think that, I don't know, Henry, if you can slant information so that it actually informs the public, but I think that letting people know that would be something that would be very much kind of on our agenda as a Board of Health issue. In Massachusetts, if you want a COVID shot, you can get one. I know I've had relatives contact me even over the last weekend saying, I'm 83 years old and I just tried to get a COVID shot in a different state and I can't get one. So I think that any way that we can let people know that it's a different scene in Massachusetts, and not just Massachusetts, some other states as well. But for the people here to know that it is possible to get a COVID shot if you want one.
Absolutely. And I would just reiterate too, that if you're unable to get one for some reason, please contact us at the Worcester Department of Public Health and our website has a, a health line that you can email us, because I would really like to know what the obstacle was that led you get refused.
And we might be able to assist, the department might be able to assist. Okay. Henry,
Yes.
do you have a question on that?
As a reporter, I generally don't participate, but I want you to let you know that we have already done a story on that.
Great. Thank you. I think it's up to us as staff and as board members to let the public know, because people are feeling pretty confused about it. So thank you very much. Dr. Hirsch, do you have anything else to add in terms of your report? I appreciate all the information on where we're at with COVID. And
No, I think that's all. And I would just thank the board for being supportive of continued vaccination efforts.
Great, thank you. Happy to. So I think then we're going to turn, Tamara, to the water quality report.
Thank you, Madam Chair. So you have the report in your package, so I will just highlight the outcomes of the quality report. The Worcester Department of Public Works and Parks Water Operations is pleased to announce that our drinking water meets all federal and state requirements set forth by the Safe Drinking Water Act. All of the details of the report, high-level categories where your water comes from, how your water is treated, water quality test results, and cross-connection and conservation tips are included in the report. Thank you.
Thank you very much. And not only is it good to hear this news, it's good that it is this news. And to thank the staff who work to keep our water safe. Thank you. If you can pass that along, that the Board of Health really appreciates that. The next item on our agenda then is the signing of letters, which we've already done. We've done the data signatures. And as I suggested, the city manager's office just asked us to hold on that other letter. So we'll find out what that issue is, and we'll get to that. And then I think, Cherry, you're back in a different way with us in your new role. And I think you're going to talk to us about what the state is doing about public health these days, right?
Yes. So I'm Cherry Tangri. I'm the grant manager for PHE, which is Public Health Excellence, the Capacity Building Grant. I will talk more about that in the slides later. So I'm here to talk about SAFE 2.0, which is short for State Action for Public Health Excellence. Desiree. Okay. Could you put it in presentation mode? Desiree, can you put the slides on presentation mode? Yeah. Yes, that one, that icon. Okay, I'll continue. Can we move on to the next slide? Second slide. So on November 20, 2024, Governor Haley signed the Economic Development Bill into law, which included SAFE 2.0. So now this new law codifies the blueprint for public health excellence, which is a document that provides recommendation on effectiveness and efficiency of the local public health system. Since this is a law, it is mandatory and required for all 351 municipalities to participate in the compliance with performance standards and the reporting requirements. Let me first give you a little bit background on how did the existence of the blueprint come into place. So back in 2016, Mass Legislature put together a special commission that was tasked to evaluate the effectiveness and efficiency of our all of public health system throughout the state. So in 2019, this commission came out with a set of recommendations which fell into 6 areas that included workforce development, performance standards, data, capacity building, sustainable funding, and cross-jurisdictional services.
Thank you, Desiree. And just to highlight here, the categories that Cherry just shared is very much in alignment with the work that the Division of Public Health has already have underway. So the workforce development, the data, performance standards, capacity building, sustainable funding, and cross-jurisdictional services. Think about the Alliance, but because we are now a part of what is called Large Cities Grant, that last bucket doesn't apply to us. But for our workforce development and capacity building, internally we have our training committee that has begun to work on all of those items and helping us to move that work forward. The data group, which you had a chance to see in some of the previous Board of Health meetings, and the work that strategic priority group is doing will help us to fulfill that requirement. And sustainable funding, my Division of Public Health, we also have a finance committee that has been started to really help focus on all elements in that category. So this slide is just to really highlight that the work is already underway and that we have some good, strong systems and structures in place to help us be able to align and comply with this new law. As the Board of Health, one of the things that will be required, and Cherry reference that as providing oversight for these individual categories, it'll be important for you to be able to see that work. So we'll be, as we've started, continuing to bring those different groups to the Board of Health so that you are able to see the work that's happening, so that when we need to do that annual report and you need to sign off on that, you will be aware of that work and support and aware of that work underway. Thank you.
So moving on, this law has also clearly defined roles and responsibilities for the local boards of health, Mass Department of Public Health, and Department of Environmental Protection, which is the DEP. So I will dive into Board of Health responsibilities and provide a little bit overview on State Department's responsibilities. So for Board of Health, and this is all regardless of whether the municipalities are in a standalone single city or town, or they are in the shared services model, they have to abide by the law. For boards of health, they are required to meet performance standards. That also includes workforce standards. And not only the workforce standard will include not only the education, training, and credential for the staff members, but also it includes all these requirements for Board of Health members. The performance standards are as critical as the other aspects of this law. These include inspections, epidemiology, communicable disease investigation and reporting, and local permitting. Anything that falls under the purview of local boards of health is something that has to be reported on. And speaking of reporting, there will be annual reports that will be submitted starting in 2026 and has to be done by August 31st, showcasing the compliance with all performance standards. And this report will be submitted on behalf of the boards of health.
So that's August 31st of next year.
Yes.
And that is my understanding why we will be getting kind of a different format and a different set of reports at our monthly meetings. So just for folks to understand that, there's kind of different performance requirements from the state as part of this law. And it's helping us think of how we might better structure the meetings so that you can feel comfortable that you've been getting the reports on those areas. Is that accurate?
Yes. So moving on, the Mass Department of Public Health and DEP requirements. These agencies are required to develop a system for increased standardization, integration, and unification of public health reporting, meaning that when standardization happens, it will allow people in all cities and towns in Massachusetts that they can expect the same level of equitable and high quality services regardless of where they live. And other responsibilities for the State Department is to create a measure of tracking the standard responsibilities of local boards of health. For example, tracking inspections, communicable disease reporting. For communicable disease reporting, we already have something in place which is known as MAVEN. And for inspections, there is a platform that is being currently developed. It's called as METRIC, METRIK. So that what that platform is going to be doing is collecting, storing, analyzing, reporting out on inspections statewide. It will be available for free to all municipalities, but participation as of now is voluntary, but the reporting is mandatory. And then apart from that, other responsibilities are to revive the executive committee that I mentioned, set forth the recommendations. They will be reviving those, that committee and discussing the amendment of SAFE 2.0. Apart from that, they are tasked with the responsibility for providing the boards of health and other municipalities or the training opportunities and any technical assistance or anything as needed. And most important of all, the Office of Local and Regional Health is holding 3 public hearings. That is something that is a requirement that is to be done by November of this year. So for that, they are holding 3 public hearings. The first one is September 18, the other is September 29, and the third one is October 8. And all these are virtual, and the Zoom links are also available on the presentation.
Did you say, Sherry, that they were regional hearings?
Yes,
No.
It's statewide.
Oh, statewide. Okay, and so what's the agenda? In other words, if you zoomed in on September 18th, are you expected to say what you think public health should be doing? Are you reacting to something that they've said? For instance, suppose you're the person who doesn't think they can get a COVID shot, as an example. Would you go on one of these hearings and say, I tried to get a COVID shot and I don't know how to do it, or something like that?
I think it's an opportunity to share ideas, experiences, and the vision with the state. And also, they are seeking written testimonies, but that is not a requirement. People can just participate to hear and listen, but if they are interested in providing testimonies, I think there is an option to do that as well.
And how is it being publicized? How do people know these are happening?
We have received it through emails, and then those who are in shared services, they are also disseminating it through their boards of health.
So should we be disseminating it in Worcester as the Board of
I
Health?
think part of this, that's why we are here to present at the meeting, and then we can move it forward, put it on our website, and disseminate it the same way.
Good, thank you.
So my last slide is about a small blurb about the current grant, which is the capacity building. But before that, I wanted to provide what the PHE grant was about. Some of you may know that we were in the it was the shared services model, which was known as the Central Mass Regional Public Health Alliance model, where Worcester was the lead agency, and we worked along with Shrewsbury, Grafton, and West Boylston. And the municipalities were tied by something known as the intermunicipal agreement. Now, since that model has dissolved since June 30th, 2025, we have moved on to something that is called Public Health Excellence and for capacity building. A more formal name for this is Local Public Health in Mass Cities with populations over 150,000, and internally sometimes we refer it to as Large City Grant. This is a standalone grant that Boston and Worcester are participating in. And this funding is designed to align the Commission's recommendation to improve the effectiveness and efficiency of our local public health system. And with this, our goal is to achieve and elevate the performance standards that we are looking into. All this work is centered in equity, where we will be receiving technical assistance from the state on any additional funding opportunities if available, or sustainable planning, networking, or any other resources. Because our goal is to create a community impact by improving the compliance with the local public health performance standards, and also expanding on these services to our residents. Some of the allowable expenses areas, or say activities with this grant, is to hire new public staff and any workforce development that we want to do, purchase supplies or software to build capacity within the department and move this work forward. Thank you.
Any questions for Chair? Yes.
Thank you for the good report. Maybe it's page 3, under the Board of Health requirements. I was interested in environmental health, especially beaches. So what do you mean at the beaches? What would you be looking for there at beaches?
The environmental health team does inspections for pools and beaches and camps, and all of these are supposed to fall. These are some things right now the IST is doing, but there is some overlap where the Board of Health has to have oversight for these. So that's why these fall under the mandated performance standards that should have Board of Health oversight. And Tamra can talk about the collaboration that we are working on.
Thank you, Cherry. So as you may recall, we had inspectors who were in the towns, and those inspectors have begun to work internally with the DPH and Inspectional Services Division of Department, ISD, to create that bridge between those two, to be able to start bringing those reports, those inspectional reports that data they're collecting for beaches, pools, camps, and the whole 9 yards, if you will, to have. Our goal is to be able to move towards a quarterly report here at the Board of Health on all things related to inspections. What are the trends? What are some things that we're seeing that are going well? What are some things that we're seeing that can be improved upon? So those details, I think, to your question, it would be included in those reports.
So how often do we check the water at our beaches?
So that's a good question. I can get back to you on that in terms of the frequency. Our colleagues in our Inspectional Services Division would be able to give you the frequency of those inspections.
The reason I ask is we've heard for all summer, hot, humid summer, how many beaches have been closed all across the Commonwealth of Massachusetts, many. I wasn't sure how often in Worcester, but I remember, I think Indian Lake had a little trouble, and maybe even Coes. And another reason I ask is that I see at all the beaches, and even at Elm Park, which is not a beach, but obviously has water, and I think we have other locations where there's water, the number of geese now is amazing. I was holding my son yesterday at Price Chopper near Elm Park, and I'm looking over into the park, and I mean, there's so many of them, and they're so brave. They cross Park Ave. They don't follow the lights, of course, but they walk across Park Ave. It's amazing to watch this, but I never thought there were so many. And I see them flying sometimes. They're going probably to Elm Park, so they probably get around. But I would think with all the poop, and it's everywhere. I know they have, I don't know if they did this summer, but they've always had summer concerts at Elm Park, and people put their blankets down on their chairs. And I've been to some of them, and I look around, and the poop is everywhere because there's just so many of them. So I would think we would have probably some problems at our beaches just from the geese alone. It seems to be a multiplying population that I think the city's going to have to start to deal with that a little more than they have. They used to do egg addling in the past to get those eggs not to hatch, and they also had the special type of dogs that they bring to a beach, and it would try to scare away the geese, but once the dog went home, the geese were right back. So I think that is a problem, and if we're going to be serious about environmental work, it's something we're going to have to look at in the future because the problem can only get worse, I think. But thank you for all you do on this. Appreciate it.
Michael, any comments? Leo? Okay, Sherry, thank you for that presentation. I'm glad to know that this is happening and that we're doing this, and we appreciate that will be ongoing. So thanks very much. I think now it's to you, Maddie. Dr. Castile?
Hi. Yes, hi, how are you?
We're doing well. How are you?
I'm good, thank you.
And I think you had an assignment.
Yes. You wanted to talk about what are the future topics that we should be able to discuss at the Board of Health. And I think homelessness is always at the top of my list. We know that the numbers continue to increase. Senior numbers are almost the highest numbers that we're seeing. Shelters are overcrowded, and sort of what are our next steps and what do we do? We know that housing is an issue. Back in 2017, we said we wanted we needed 103 units. We're up into the 60s of those units and still need more. And so it's a difficult time to be able to get the funding for housing. And so that's become even more difficult. And so those issues and looking at the data of what happens with homelessness, I think is important. I think from the standpoint of ISD, from inspectional services, I think that being able to get reports on some of the programs that have permanent supportive housing, how are they doing, how are people doing, would be important. I think one of the things that we see sometimes is that eviction rates in that population, even though people do stay in housing, people with substance use and mental health issues, that they don't have strong services, are not staying in housing. So we need to be able to advocate for more funding to be able to have more case management. Once a week sometimes is definitely not enough with people with substance use or mental health issues. So housing, services, homelessness, seniors being homeless are issues. Certainly mental health that we've been talking about for a long time is important. And mental health in the school systems, mental health in seniors, um, are important. I think at some point I want you to know about our tiny homes that we're trying to put together, which are our thoughts of it being a public health entity in the sense that we should be able to, as a community, to provide housing for people. Otherwise, we're going to have an more increase than we've had of homelessness. So I think that's a method of how do we do this as a community, because otherwise we're not going to move. I don't know if you've seen some of the areas in the city where encampments are. Really on the sidewalks. You're now seeing more and more tents on the sidewalk. And these are people who are not interested in services, and in spite of the fact that people, different outreach groups have gone to those areas to see them. And, what's our next step and what do we do in those situations? I think food insecurity is another issue that's important. What are we doing? Families being able, and especially with cuts, families not being able to afford, food, and what are we going to do in those situations? The cuts and SNAP benefits are important in that. I think those are major, I guess, for us to look at. What are your thoughts?
Thank you. So we had asked Maddie, knowing that she was leaving us with her wisdom as she retires, what were some of the things that we should be paying attention to? And so whether she's talking about homelessness services or mental health or food insecurity, those are kind of, I think, some of the unmet needs, if I were to put a title on it, that you're really concerned about, kind of as you leave this position for us and your successor to carry on.
Through the chair, I'd like to add one more. I think that, I know you had a presentation, I don't know, a couple of Board of Health meetings a few months ago regarding data. I'm still going to stress the fact that we need more data. We need data just even to, again, to figure out where the inequities lie in our city. Let alone countywide in Massachusetts. But I think for us to be able to function without that data, knowing the rates, as we talked about, for example, maternal morbidity in our hospitals, and in Massachusetts rank about number 3rd or 4th in the country of having the highest maternal morbidity. So I think that data like that, we need to figure out what we do. And I know that Maura is going to be talking about that, but overall, what's our rates of hypertension in the city? What's the race, ethnicity of people who are having higher cardiac disease, higher rates of diabetes? We need to know that for our city. I think it's important. But also, I think taken into consideration, if we're having mass health cuts, what is access going to be like in the hospital settings, in the health centers, and are we able to take care of our community? I know that the free clinics are totally being overloaded with patients, and that's just we haven't seen all the mass health cuts at all yet.
Thank you. Leo, any questions for Maddie? Michael?
I guess the one question I have is concerning homelessness for seniors. I didn't really realize that it was really becoming an issue. Do you have an approximate number of people, seniors that are homeless right now, Maddie? To the chair.
I think the Central Mass Housing is trying to calculate those numbers now, but just on our scope of our shelter, They were one of the highest. I mean, usually 35 to 44 is one of the highest groups. They are right about there, just in our shelter. But nationally, it's going to still be the same, and statewide that those numbers are higher. I don't know specifically what those numbers are in Worcester right yet, because CMHA is looking to see those numbers now, trying to get the data for us. But people that are unable to pay for their housing, that either whether it's rent or their mortgage, unable to pay for repairs in their homes, are causing people to leave their homes. You know, there's been cases of people who are living in maybe a trailer that they bought without access to water. I mean, so that you're seeing all kinds of different stories with people. And certainly the cost of living in Massachusetts has increased. And so it makes it even more difficult that if you're a senior and you're living on a set income, that it's very difficult to keep up with that. And so that's what we're seeing in the community.
Thank you for the answer. Appreciate it. Thank you, Madam Chair.
Okay, Gary, questions for Maddie?
Thank you, Madam Chair. Dr. Castile, and I think you hit on this. We talk a lot about affordable housing and the great need here in the city of Worcester. But for a lot of people, when they try to get affordable housing, it really isn't affordable. So much of it isn't affordable. It might be, the wrong term for that type of housing because people are getting priced out. And as you said, because I've volunteered for years at the senior center, I talked to a lot of people, and they are worried about being homeless. Their income is fixed for years, and the housing they have, and a lot of times it isn't even good housing, it doesn't stop going up. So that's been a big problem. I'm not up to date on this, but maybe you are, Dr. Castile, and that's the senior center itself, the facility. The city of Worcester owns the building and operates the facility, of course, the Department of Elder Affairs. And we talk about in the city, all of us, elected officials, appointed officials, candidates, everyone talks about the need for more affordable housing, and especially for seniors. Just had, I think it was the past June, the 25th anniversary of the Worcester Senior Center. 3/4 of that building is still unused. 3/4. It was the old nurses' dorm for the St. Vincent Hospital. And we talk about the need for housing, and that space remains empty, could be affordable housing for our senior population. And what better for them than to be connected with the Worcester Senior Center, where they could go down there and, do all that they do there, 5 days a week anyway. So I think that's just a shame here in the city. And I don't know, we've looked at developers in the past, and I don't know if you know, Dr. Castile, are we close to finding a developer? Do you know?
Nope. Through the chair, we did find a developer that is looking at the property and looking at doing, they won the bid. They're looking at doing affordable housing at that whole nurses section of the senior center. So that will be happening. Now, when that's going to come up, it's a number of years. And remember, funding is an important piece, but they are working on that. So that is to happen. I wanted also to tell you, through the chair, if that's okay, I'm reading an article about, and it talks about, I guess they're the Go Banking rates, or the ones who are estimating what the cost of living is for a senior. They're estimated to have at least $1,645,000 in savings to retire in Massachusetts, and the annual cost of living for them sits at $88,000. So if you think about that, I don't know how many people can afford to do that. So we're one of the highest states that have obviously the highest cost of living.
And what's funny, here in Worcester, over the years, we've built many, many schools, and I support each and every one, and we still have a few more schools we certainly have to get to, some very old ones. But the city borrows money. We issue municipal bonds. We borrow money to build schools. We borrowed money to build another project that I love, and that's right down the street, Polar Park. The city should take a look at building housing. It's looking for developers. You know, we should be maybe taking a look. Can we issue municipal bonds? Can we borrow money to build housing? Could have been done 20 years ago at the Worcester Senior Center, that facility we owned 25 years ago. We could have done it a lot cheaper then. So it's an unusual approach to building housing. But there's no one who ever complains about us building schools. Yeah, a lot of people complained about Polar Park. I think it's a great project. But maybe we should turn to housing, and maybe as you advocate, Dr. Castile, and work with the city manager and some of the elected officials and appointed officials, you might bring that up. Housing, especially for seniors, but for our entire population, it's, you know, more than just seniors. I think the city could do more on its own, just like it does with schools. Now, there's funding from the state. I think it must be at least 60% to build a new school. But there might be funding available to the city if they were to do their own developing. Just a possibility, a suggestion, because what we have now is not working, and it hasn't been working for a few years. But Dr. Castile, for all you do and still are doing with us, thank you very much.
Thank you, Gary. Dr. Castile, I would just like to say, which I know, a comment which I know you started last month when we learned of your retirement, which is to really thank you for the work that you have provided to the city of Worcester through this role, to the people of Worcester in many roles over the course of your career. And to know kind of what you're worried about on the way out is a good thing for us, because those are places where we should continue to place our focus. And there's just a number of areas, the work that you've done has really led us along, I think particularly of substance use issues, where your career has really led us to a different way of thinking about it over time in the city of Worcester, whether it's needle exchange programs or substance use services and those kinds of things. And some of these other areas need that kind of focus. And so we hope we will carry your legacy forward. Thank you for all you've done.
Thank you. Thank you.
Okay, I'm going to turn then to Tamara, your director's report.
Thank you, Madam Chair. So I'm just going to walk through the director's report pretty quickly. You all have the details in front of you. Want to do a recap on the previous Board of Health motions that we that we want to make sure are not outstanding, and then move in some sort of key topics of current public health affairs towards the end. Just a note for our previous Board of Health meeting, a motion for the board to vote for the WDPH staff to issue whether we should be a delineation and regulations between smoking bars and retail establishments. To give an update on that, the Division of Public Health staff are currently reviewing the regulations and will work to provide a comprehensive report once that process is completed. That will take some time, as we noted in the last Board of Health meeting, but wanted to just go on record stating that work is already underway. Just recapping, for the month of July, we did complete the report out for the 500-foot limit for the tobacco regulations. We gave that presentation in August. Also, we signed the Board of Health letter tonight for the letter supporting the WIDE initiative, so thank you for that. For the month of June, one outstanding item we have from a motion that the board made was the Office of Diversity, Equity, and Inclusion shared that the Board of Health could potentially have the Office for Refugees and Immigrants present at a future Board of Health meeting to make the content around what could we possibly do regarding Know Your Rights and all of the work that was sort of discussed during that board meeting available to the public. So we said that we wanted to discuss that at a later date. I wanted to check in with the board to see if there was a preferred date for that.
Yeah, I know that we had a very busy couple of agenda months, but I'm thinking that there might be more room for that kind of training in terms of the Office for Refugee and Immigration presenting a Know Your Rights segment to this board. Is that something people would be interested in? And if yes, let's schedule it.
Yes.
I'm seeing some nods. Okay, so our next meeting would be in October. Are we ready for this in October, and are we finding anything that would prevent us from trying to do that in October?
Madam.
I'm going to be away in October, okay, and I'm not sure if I can do it virtually, so I appreciate maybe if we could put it off to November.
Okay, November. Does that make sense? I think November is likely to be the day before Election Day, our Board of Health meeting.
Fourth Tuesday.
So we would,
So we
so-
should go at the 11th? Yeah.
well, the 11th is a holiday.
Is that Columbus Day?
No, it's Veterans Day,
Oh, Veterans Day,
November 11th.
sure.
So the 3rd is the day before Election Day, which we would normally meet, but I may be a conflict for one of our members, I'm not sure. And the 11th is probably a holiday. So we'll take a minute to look at that calendar, but let's say that we're, at the request of a board member, we're trying to look at it in November and not in October. Okay, sorry, we interrupted your report. Let's let you
No,
finish,
that's
Tamara.
a part of the report. Thank you for that. Just wanted to close the loop on the request from the board to reach out to the Immigrant Legal Resource Center in San Francisco to seek guidance on how the organization assists immigrants in achieving protection. We are in the process of reviewing the ILRC guide, and that also needs to come back to the Board of Health in terms of our findings and recommendations. So wanted to also check in on that.
So would there be any problem with bringing that back in October?
I don't see any problem in doing that.
They don't have to come on the same night. Okay, so let's plan on that for October.
Okay. Thank you for that. Okay, the recap for the primary care for you is on hold, as we noted earlier. And then just moving into some current state items in the public health space, wanted to provide an update on the House of Labor, Health and Human Services and Educating Related Agencies, the Appropriations Subcommittee. The bill is out, and the report hasn't yet been released, but some of the key elements to highlight is $108.6 billion for the HHS, a decrease. This is a decrease of $6.8 billion from the FY25 enacted level. The bill would also provide a total of $7.4 billion from CDC, which is a decrease of $1.7 billion below FY25 enacted level. The bill does outline $100 million for the Make America Healthy Again activities, although those activities are not clearly defined. So just wanting to keep the board abreast of the different activities at the federal level, and we'll continue to monitor that information as it comes available.
So if I could just ask for clarification on that. I think what you're telling us is the funding streams are changing from the federal government, and we're not
Yes.
sure what that means, because some of them probably go to the state first, and some of them might be available to us directly.
Yes,
Okay.
thank you. Just as an update on some child-safe packaging for nicotine pouches, I know that tobacco regulations is something that we follow closely here at the Board of Health, and so the FDA has called for child-safe packaging for nicotine pouches to really help ensure that the nicotine pouch makers adopt child-resistant packaging. So they're seeing challenges and issues with children, especially under the age of 5, getting a hold of these nicotine pouches, and some of those outcomes being potentially fatal, even in smaller doses. So there's a push at the FDA level to help increase safety as it relates to access for the young individuals in their population. And we've raised this at the Board of Health prior to, but I thought it was important to share an update that the administration has been ordered as a result of a court settlement announced on last Tuesday, that agreed to reinstate dozens of health agency web pages and data sets that had been taken down to comply with executive orders on diversity, equity, and inclusion and gender identity. And they are supposed to restore those web pages to their original versions as of January 29th of 2025. Those versions is where that restoration should occur. So wanted to just give an update on that, as that has been a topic of discussion here at the Board of Health as well.
And we will hope to see that. I have a couple of questions. One is, I got a notice about maternal child health data being released in a different way from the department. Can you address that?
Sure. So we're very excited to share that our maternal child health dashboard, which was referenced, I think, probably about 3 months ago, we had our data research and epidemiology team present out on the dashboard initiative. So that dashboard is now live to the public, which is the first time that we've been able to make that happen. So really being able to put data at the fingertips of our community members as it relates to how we're doing on maternal child health. And as we continue to promote and implement interventions, how that's impacting in a positive way those key performance indicators and the overall health in the MCH space.
Okay. Anything else, Tamara?
One last thing, we did get our FAB site visit scheduled. So our accreditation visit will be occurring on October 22nd and the 23rd. The team has been working diligently to prepare for this visit. And we're looking forward to seeing the success in that accreditation visit as well.
Great.
Okay.
Thank you very much. Okay, I think then we've just made a next meeting date and topics for 2 different pieces. In October, let's look at those dates. So as I look at October, Indigenous Peoples / Columbus Day is the 2nd Monday, so meeting on October 6th should be fine. Does that sound okay? Does that work for you? Okay. And then we get into a little bit more difficulty in November. First, when we would normally meet is November 3rd. Is that a problem for anybody on this board?
Because it's right the day before the.
Right.
Just that night, I'm sure the business.
Okay.
You can go on without me, I don't mind that, I've never missed a meeting, and I keep my perfect record.
Okay, so then the next we run into Veterans Day. Do we want to go all the way to the 17th? Does that work? That works for you? That works for you? Okay, so then I would say the date that you're trying to get the ORI people here is actually November 17th. Is that okay? Then if there's no other business, I'm looking for a motion to adjourn.
Motion to adjourn the meeting?
Seconded.
Okay, I have a motion and then it's been seconded. All in favor? Gary?
Gary Rosen, yes.
Leo?
Leo Negron Cruz, yes.
And Francis Anthony's yes. So thank you very much for coming.